This right here is our EMS jump bag, and today I'm going to go through all the main equipment in the ambulance so you have a leg up when you enter school. Let's get after it. Okay, so first, in no particular order, we're going to open this up. Here we go. And we're going to start with, this is a very important piece of equipment. This is called the bag valve mask, okay? This ending connection. We're going to see this in, nasal cannulas. We're going to see this in anything that needs to be hooked up to oxygen, okay? Now, what do? Well, there's a term called ventilation, okay? Ventilation is when we breathe in, when we breathe out. So what if we have a patient and they need help, they need assistance with their ventilations, breathing in and out? This is the basic tool of that. It's called a bag valve mask. So this will attach the oxygen right back there in the ambulance. And we're gonna help the patient breathe by placing this mask over their nose and mouth. And we're gonna breathe in about one breath every 5 to 6 seconds, okay? Making sure we're not squeezing the bag too hard or too fast. We don't wanna do that, okay? Now, let's go to the next one. So this is pretty important, and this is like basic stuff. You're gonna laugh, but it's gloves. Now, why gloves? You don't wanna be this EMT or paramedic. Okay, you get dispatched to a 911 call. Your adrenaline's going, okay? Maybe it's your first time on shift and you're nervous. What happens? Your hands get sweaty. So you wait until you get to the scene to actually put your gloves on. And you're struggling to get your gloves on, patient's bleeding or the patient's ill or injured. We don't want that. So here's a little pearl. I always tend to keep gloves either in the side pocket of my pants or right here, okay? It's smart also to carry some for your partner. What if they forget, right? What if you have a first responder who forgets, or we rip or tear a glove, again, because our hands are so sweaty. I've been there, okay? So when you're en route to the call, maybe you're 5 minutes out, put your gloves on. This is under something we call an EMS. Big term here, let's put it on screen. BSI, okay? This is big term, but hang with me. Body substance isolation, meaning I'm isolating any substances from the patient to me or vice versa via gloves. Next thing we're going to talk about here is we're going to talk about this mask. Okay, this is an N95 mask, okay? With an N95 mask, first off, when do we wear this and why do we wear this mask? Okay, now you're not going to wear this mask on every call. On every call, you're going to use gloves. Every patient, every time, you're going to wear gloves without exception. Now, where the mask, like an N95 gets involved is you would don this mask. You would wear the mask as an EMT or paramedic when the patient has a respiratory illness, okay? This could be a lot of different things, right? This could be the flu. This could be TB, okay? This could be C19, right? It could be a lot of different things. But if they have a respiratory illness, you would be the one donning this mask. Again, I have a pearl for you. I like to carry one of these, again, on one of my side pockets. And I always think about your partner. I carry a second one over here in case my partner forgets. Because what can happen? Let's say you're dispatched to a call. And you're dispatched, let's just say you're dispatched to a call for something completely different than respiratory. Let's say it was a psychiatric patient, okay? And then you get there and it ends up being, it's a respiratory call. That's why you have it in your pocket. Perfect? All right, let's continue. This right here is actually something very advanced that only paramedics use, okay? Remember, the EMT is the first level in the ambulance. Then we have the advanced EMT in some areas. We'll talk about that. Then the paramedic level. This is the paramedic level skill. Quite simply is this. We have 2 lungs, okay? We have 1 heart, we have 2 lungs. If I get in a very bad car accident, something can happen to my lungs called a tension pneumothorax. Now that sounds crazy. Simply put, you have a collapsed lung and your blood pressure is very, very low, okay? So what happens is we have the lung. And the lung is starting to collapse because there's all this air pressure around the outside of the lung, making the lung like this big, okay? This is called needle decompression. We're gonna place this needle into the patient's chest. That sounds crazy, but it literally saves lives. We're gonna place this needle into the patient's chest, and what it's going to do is release that air pressure on the collapsed lung. So if you ever see this, don't open it up. It's not a pen, okay? So, and I'll show you here what it looks like, okay? We open it up. You can see here, this is our needle here. This is a 10 gauge catheter for needle decompression of a tension pneumothorax. Now, stay tuned. If this is the first video you've seen of mine here, we talk about all this. We go into lessons, we go into tutorials. So make sure you subscribe, hit that subscribe button. Next piece here, I'm gonna do a 2-for-1 here. These are probably the two most important bandages that we have in EMS. Okay, so put this down for a moment. First here, we have our stretch bandage, our conforming bandage. This is how we're going to wrap wounds, lacerations, cuts, okay, whatever you want to call it. This right here, okay? If I open this up, and I'll show you here, I'm gonna pop it open. We can see how this is essentially all rolled up, and you see how it opens up. So this, you've probably seen in movies and TV shows, this is where we're actually gonna bandage wounds and bleeds, okay? Now, I'm gonna talk later on about some simple bleeding control, so stay tuned for that. We're gonna talk about tourniquets. You're gonna wanna see that. So hang with me, but this is gonna be our main bandage of EMS. This is something different. Now, you hear the word bandage, you think bleeding. Well, this, it's a triangle bandage. I'm gonna open it up. And this is actually for something completely different. It's for a sling. It's for an injured arm, for a broken arm, okay? So you're gonna hear a term about a sling and a swath. A sling holds the arm up, while a swath actually holds the sling together, okay? So this is a triangular bandage that you're gonna see here. And they all look like this. You can see it as I open this up. Check it out. So this will be used for a sling and swath. So this is your, bandage, if you will, that you will see for that. And you're gonna create a sling out of this patient's arm. This is pretty cool. Okay, let's continue. So next piece here, what is gonna be next? Comment below, what do you think I'm gonna pull out next? Let's find out, right? Well, I'm actually not gonna pull out anything else next because I wanna talk about what's on my neck, the scope. This is an extremely important piece of equipment in the ambulance, your stethoscope. Why? This is how we listen to heart sounds, to lung sounds, and to bowel sounds, okay? Now I have two big important pearls to tell you about this scopes in general. Number one, when you're a new EMT, when you're new on the ambulance service, people always ask me, should I buy a new scope? Yes, you should. If you're serious about becoming an EMT, I cannot recommend enough getting a high quality scope. Like Littman here, they make a very good scope. I would recommend it. I've used this throughout my entire career, okay? And the beauty of scopes in general is they last a very long time. Here's why. When you come on the ambulance, they typically give you a scope. It's in the ambulance, it's very low quality. And when you have a diesel engine, and when you have loud noises, and when you have loud patients, and when you have chaos in the back of the ambulance, and sick and injured patients, it can be hard to hear, especially when you're new. You're also going to use this to listen to your blood pressures in the back of the ambulances as well. So, for $50 or $100, and some areas even $150, a scope can last you 3 to 5 years, even longer. I know people are gonna be in the comments blowing me up. Mine's lasted 10 years. Yeah, for sure. This scope has lasted it's going on 10 years. So it's worth the investment. If you're serious with this career, do it. You will thank me later. Okay, so scope, very important. Now I wanna get into some airway stuff. And you may have never seen this before in your life. If you're brand new to EMS, you're going, what is this? Okay, well, I'm gonna pick this up again. Remember earlier here, we talked about the bag valve mask. So literally, okay, this is our BVM. This is gonna go over the nose and mouth of the patient, and we're gonna use this attached to oxygen to breathe through the patient. You with me on that? Okay, now, hang on here a second. What we have here is called an airway adjunct. Folks, I want you to think for a second. If I'm trying to ventilate the patient and help the patient breathe, wouldn't it be nice if I use something like an adjunct to keep the airway open? That's what these are. So we have an OPA, an oropharyngeal airway, and an NPA that goes to the nose, okay? Now, both airways work. What's the difference? Well, typically, the OPA is used in unresponsive patients because people have what's called a gag reflex. So if they're, semi-responsive and you're ventilating them, this is not gonna work. This can be used and it can bypass someone's gag reflex through the nose, okay? So I'm gonna show you a little pearl, a little education tip you can take right now, okay? When we're managing someone's airway, we have to first open the airway. Then we have to make sure the airway is clear. So any blood or any vomit, we can suction that out. Then we keep it open with an airway adjunct. And then step 4 is we ventilate at the basic level with a BVM, and then later on, we're gonna talk about some advanced stuff. This is pretty cool. Learn something new. Okay, smash that like button and let's continue. So next here, as promised, this is your tourniquet, okay? This is bleeding control. Now, I'm gonna share this with you. This is not the piece of equipment that you're gonna be taking out every single week probably in the ambulance and using, okay? Unless you're in an area that has a lot of trauma, okay? This tourniquet is reserved for what? Major bleeds of the extremity. Extremity meaning the arms and legs, okay? I can't use a tourniquet on someone's neck. I can't put a tourniquet on someone's chest or their stomach, right? It's only the legs and arms. So they had a major bleed to the extremity and direct pressure has failed, which is our first step. Gloved hand, direct pressure. Next step after that has failed. We've bandaged the wound. That's failed. We put pressure on top of that as well, and it's still bleeding right through. We have something in the ambulance called quick clot. Okay, quick clot, we can put this stuff into the wound to help it actually stop. Okay? Now, what if that fails? What if everything that we do to stop this from bleeding fails, as far as bandaging, as far as wound dressings, as far as quick clot, and nothing else can stop? Listen, what is this used for? Arterial bleeds. Essentially, we can't get you to stop bleeding, and you have an arterial bleed to an artery in the body, right? So if we think about levels here, we have the capillary bleeding, then venous bleeding, then arterial bleeding. This is mainly reserved for arterial bleed and major bleed. Make sense? This saves lives, okay? And stay tuned to the channel, we'll have a ton of tutorials on all this stuff, so hope you're enjoying it. Let's continue. I'm gonna tell you what this is. Hang with me, okay? If you're not aware, our NREMT exam prep app is the first link in the description. I give you lifetime access. Now back to the video. So here we have an IV catheter. So you may have heard about doing an IV, okay? Maybe you've had blood drawn before, right? What we have here is an IV catheter that we use in the ambulance. And why do we use IVs in the ambulance? Well, we use IVs in the ambulance because we need access to give IV medications or fluids. Remember this thing that I pointed at you earlier? Okay, this right here is something very interesting and is used by paramedics. So, a basic EMT doesn't do IVs in most areas. Usually it's the paramedic and the advanced EMT that uses this. This is how we get IV access to an IV catheter. This is intraosseous access. That sounds crazy. What it is it is medication access or fluid access through the bone marrow. And we can do this in a few different areas, okay? Now, let me see if I have one here. I want to show you something real quick. Here we go. So, this you're gonna see. Do not confuse this with this because we use some slang in the ambulance, okay? This is a tourniquet that saves somebody's life. This, people also will call a tourniquet, but will not save anyone's life, okay? This is basically the paramedical term would be a constricting band. Okay, this is a tourniquet that is used to pump your veins up for an IV. Okay, pretty cool. So again, main thing here with IO access and IV access is medication and fluids, which I'm going to show you right now. Okay, now write in the comments real quick. What medications could we give in EMS? Why? Well, EMS is about life threats, right? So your heart rate could be too low or too high. Your blood pressure could be too high or too low, right? Your oxygen's one. Your oxygen level could be too low. We give you oxygen, right? You might not be able to manage your own airway. What if we need to, what about the lungs, right? What if we need to give medications deep into your lungs because your lungs are constricted? Well, there's a lot of things we're going to talk about. But before we do, let's talk simply. And when I talk simply, right here, I have for you IV fluids. It goes along with the IV, so we'll do this next. So this right here is a very old bag of normal saline, going for training. So, wow, it's July 18. All right, here it is. So this bag right here is normal saline, okay? Why do we use normal saline, folks? Think about it. We use normal saline in patients who lack volume, yes, but we don't pump people up with normal saline. Mainly, it's going to be for dehydration. There's also, I don't have a bag here, but another, I'll put a picture on the screen, lactated ringers, okay? The difference is normal saline just has sodium and water in it, and it goes right into your vein, okay? At the ending here, I'll show you, this ending right here goes in to your IV catheter, okay? It's going to be actually what we call a little lock, okay? A little part, if you will, hanging out of the IV catheter that this will attach to, and we can give the fluids to the patient. So sodium chloride is going to be sodium and water. Lactated ringers has potassium in it, has electrolytes in it. Some people call it a banana bag because of that. So both can be used for dehydration, but now you understand how that works. Pretty cool? All right, beautiful. Let's continue. So first here we have an EpiPen, okay, an EpiPen. Second here we have the drug aspirin, okay? Now these are two main EMS drugs, okay? Epinephrine can be given a lot of different ways, okay? But we'll just talk about it for in this context of the EpiPen, why we use it. And we have aspirin here. So let's talk about these. Let's start with aspirin. Now, aspirin is given, it's for baby aspirin to an adult patient who is experiencing a heart attack. Why do we give this? To make them feel no pain? No, okay? We give the aspirin to the patient because it is an antiplatelet drug. What this means, when you're having a heart attack, folks, let me show you here. When we're having a heart attack like this, okay, there's plaque going on in my coronary artery. It's blocking part of my heart. So my heart muscle is literally dying because it's not getting any oxygen and blood, okay? So what happens is aspirin goes in to the body and says, hey, look, stop having all these platelets stick to this plaque that's going on. So essentially it can make the clot not get worse. Okay, that's aspirin, okay? Now epinephrine, now this here is epinephrine in EpiPen form. So for this video, let's just talk about why we would give this an EpiPen form, okay? Now, some patients, this is actually like a patient, you know, like a patient EpiPen here. You can just see it, right? This EpiPen is used for anaphylaxis. That's a crazy word, right? Let me explain. Anaphylaxis is essentially where your body has an allergen and the body itself goes absolutely crazy because you have this allergen going on, okay? So what happens is your lungs get very, very, very tight. You start wheezing, okay? And you can't breathe. So what epinephrine does, this drug right here, and why a patient will carry it who's like, for example, allergic to bees, is it bronchodilates. It acts on a receptor in the body called the beta-2 receptor, and it opens up the lungs. Now, If you are learning a lot and you're new to EMS right here, I want you to smack that like button. I want you to hit subscribe to this video right now, and I hope you have learned something new, okay? The best thing you want to do, folks, if you're watching this video right now, is you want to get this information right here. It's 2025, we're going to 2026 here. Get the information right here with me now, so that when you go into school, you're not seeing like a deer in headlights for the first time. That's why I'm here as paramedic coach. Come on, all right? So let's continue. So this is actually probably one of my most favorite devices because you use it a lot. And this is a mask nebulizer. I love the mask nebulizer, and here's why. I can pop this off, okay? And in here goes medications. And remember I talked to you about that patient a second ago who was in anaphylaxis that can't breathe because their airways are getting really, really small? Well, that happens also in asthma. That also happens when someone has a COPD flare-up, okay? So I can put a medication called albuterol, okay? I can put a second medication called ipratropium inside here. Remember what I tell you earlier about the BVM? This attached to the oxygen, right? Exactly. I can hook this up, 6 to 8 liters of oxygen, give this to the patient, right? Plop it on, and now they're getting a bronchodilator medicine straight from the nebulizer. Now, how cool is that? Is that pretty cool? You can see how it all connects here. We connect here and into the oxygen. Is that awesome? All right. So this is the mask nebulizer. It's for giving medications through inhalation. Okay, getting medication down to the lungs, which, by the way, the lungs absorb medication. Pretty cool? Okay, beautiful. So you're probably wondering here, Evan, why are you holding these giant scissors? Well, I'm probably at a trauma call. I'm probably at a stabbing, or I'm probably at a shooting, okay? These shears, typically you hold them here on the side of your pants, wherever they fit on the side, okay? These are called trauma shears. These are used to cut clothes, so we can actually expose the patient and see what's going on. So remember this for the rest of your career, okay? If you do not expose your patient, you could possibly be missing a very, very important life threat. And also, never forget this, the patient's back, okay? When the patient's laying in the stretcher, we can commonly forget about their back, so please don't forget about that. All right, so now look here. We have what I like to call advanced airways, okay? So there's a few different things here, and we can see, wow, you can see this is advanced. All right, now look. We talked earlier about the bag valve mask. Okay, that's a basic airway. But what if we're not able to ventilate effectively, maybe because of trauma, maybe because of the airway, or we just want to establish a better airway, meaning a better airway, an airway that's closer to into the trachea, into the vocal cords, okay? Well, I got a few tools here, and I'm gonna start with the advanced EMT tools, and we'll finish with the paramedic one, okay? So this here is a King LT airway, okay? This right here is our iGel airway. Now, these are two different airways that would be one level up on our BVM here, okay? So BVM here, okay, we got that. And then more advanced airways, okay? iGel, King LT, right? Now, places where we might use this, again, it's gonna be if we have an advanced EMT on the ambulance or a paramedic. Typically, EMTs don't go over this stuff. Sometimes they do, depending on the area, but this airway is basically gonna sit at the end right here, literally right on top or right near the patient's trachea. But hang with me. This right here is called endotracheal intubation. Okay, this tube right here is actually going to go through the vocal cords and go into the patient's trachea. So think about this, folks. We have a BVM, which is a basic airway. It's all the way out here, providing ventilation out on the mouth and nose, pushing air in and out. We have I call it the AMT airway, or King LT, or iGel. that is resting literally right before the opening to the vocal cords. So we're not in the trachea, we're right before the vocal cords. Sits right there. It's simply just placing it down to the patient. Whereby this, we use this blade right here to maneuver the patient's, literally the patient's mouth. Okay, we're lifting forward and upward, then placing this down into, we can then actually visualize the vocal cords and place this into the patient, removing this, taking this out, which is a stylet, and then keeping this into the patient. This is called endotracheal intubation, and you've just intubated the patient, okay? So that is what we're looking at here as far as equipment. I got some bonus stuff for you. So let's talk about bonus. So first, here we have is a vest, okay? This vest is very, very important because if you're on the highways, if you're on the roadways, this is where you take this out. So you're in a motor vehicle accident, this basically should go right on you while you're in the ambulance. I like to keep this either here, back here in the seat, we can just grab it and put it on, or even right here in the front of the ambulance, okay? Now the last piece, I said the best for last, this probably, well, I don't probably, this, besides medications, would be my favorite equipment that we use because it makes a paramedic the paramedic, the heart monitor. So, simply put, folks, as I wrap this up for you, is this. This heart monitor does a lot of things, but primarily it does EKG reading. So it's going to read the electrical activity in the patient's heart. Okay, now we can get heart rate off this, we can get blood pressure off this, we can get the patient's oxygen level off this, and again, most importantly, we can get an EKG reading from right in the back of the ambulance, in your home, anywhere. It's completely portable. You can see I can pick it up here. This is probably the most important piece of equipment that we use as paramedics. It's the cardiac monitor. This here is a LifePak 15. They have different versions, but that gives you a gist of some of the equipment that we use in the ambulance. Hey, if you're getting ready for school right now, where it's EMT, AMT, paramedic, first responder, whatever it is, first link in the description is lifetime access for you to our NREMT Prep app. Make sure to hit the first link in the description, join the video vault, videos, practice questions, our community group, study plans, everything you need. Over 60,000 students have gone through this program, so click the first link in the description and I'll see you there.